Hello everyone, thank you for joining us today to our latest Queen Elizabeth Scholarship webinar. Those who are joining us here in the room at the McMaster Health Forum in Hamilton, Ontario, and those who are joining us online, we appreciate you coming out and supporting our scholars. A little bit of an agenda for you before we get started. I will tell you a little bit about the forum. I'll tell you a little bit about our current Queen Elizabeth Scholarship Program and then our new Queen Elizabeth Scholarship Program, and then I'll introduce you to our two scholars who will each do their individual presentations. The Master Health Forum here in Hamilton, Ontario, McMaster University is the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program here at the university is run by a partnership between the Rita Hall Foundation, the Community Foundations of Canada, Universities Canada, and Canadian universities. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The Forum's version of the Queen Elizabeth Scholarship is the Strengthening Health Systems program. Our scholars contribute to strengthening health systems and become part of our large and growing network of health system leaders. We also now have a new Queen Elizabeth Scholarship Program here at the Forum, so we are proud to be selected as one of 20 institutions to host the new round of scholars. It is expanded in scope in terms of what we are looking at, so the name has changed slightly, so we are now the Queen Elizabeth Scholarship Program in Strengthening Health and Social Systems. This new program is very similar to the old program with a few subtle differences. So the location of the internships has expanded beyond Commonwealth countries to include low and middle income countries. Our partners have expanded to include those in such countries. So specifically we have new partners in Colombia and Lebanon. We have a new focus on social systems as well as health systems. We have expanded the eligibility programs here at McMaster, so that includes arts and science. And the number of opportunities has decreased. So because of the funding of the new program, we were only able to offer half as many scholarships as we were able to offer in the original program. A long list of scholars from our original program. There were 61 in total. Our two presenters today are from this group. Here's our first cohort of scholars who went away or visited us primarily in 2016. Our second cohort primarily went away or visited us in 2017. And then our third cohort, or last cohort in this original program, was primarily went away or visited us in 2018. Our two scholars today come from this cohort. And our first of those two scholars I will introduce you to now is Nawazish. At the time of his internship, he was an undergraduate student in the BHSC program here at McMaster. He has experiences in clinical and genetic epidemiology research. He's interested in exploring the influence of genetic and social determinants of health on policymaking and health system decisions. During his internship, he hoped to better understand the collaboration required between community members, researchers, policymakers, and healthcare providers involved in health systems decisions. Please turn it over to Nawazish.
Thank you, James. So thank you, James, for giving me this opportunity to talk about my time at the Sax. And I think I was talking to James about this, but this was one of the best times that I had in my entire life. And I think it's been 3 months since I returned from Australia, and there isn't a single day that I don't think about Australia. So needless to say, I had a wonderful time. So just before I start about talking about my QS internship, let me just talk a bit about the Sax Institute. So it's pretty similar to the Health Forum in the fact that it is a health policy research institute. According to their words, which I took off their website, they aim to be the bridge between health researchers and policymakers. So they have a wide range of things that they do, and the things that I was focused on was their research division. So just to give you an idea of the type of things they do, one more thing that I want to say before I start is Australia is pretty similar to Canada. So you will see that a lot of the things that they were doing, you could find a lot of parallels with the things that we do in the Health Forum as well. So they have, one of the things they do is the 45 and up study, which is a study to find some of the issues that the aging population within Australia is dealing with. This is something that's pretty similar to Canada. they also have another study called SURE, which stands for the Secured Unified Researching Environment. So this is a cool study that they have to really understand some of the dynamics in play with online databases and online research. And Australia actually has some pretty strict online information laws, as well as the fact that they have a two-tier system, a private and a publicly funded healthcare system. So because of that, there is some information overlay that's between the private and the public healthcare system. And due to that, this study is actually very valuable to understand what are some of the considerations that they have to make. And this is something they're really doing, which I found really cool. Now, the thing that I was involved with was with SEARCH, which is basically focusing on some of the issues and some research involving Aboriginal children within urban settings. And before I start to talk more about SEARCH, let me just give you a brief historical context to why SEARCH is so important. So similar to Canada, Australia also has a prior colonial rule. And for the sake of this presentation, I will be using the term Aboriginal, but know that I refer to both Aboriginal and Torres Strait Islander peoples, which are the indigenous people within Australia. So because of the colonial rule and the subsequent European government that was established in Australia, the Aboriginal people, they lost a lot of their autonomy, they also lost a lot of their identity. And that resulted in subsequent consequences, such as the fact that they lost a lot of their traditional ways of living, such as their traditional ways of diet. And that had a lot of consequences, which we actually saw within my own work that I was doing there. And because of this complex history, there's a lot of existing health, economic, and social disparity between Aboriginal and non-Aboriginal populations within Australia. And this is actually the focus of SEARCH. So SEARCH was looking into specifically the health disparities that exist between Aboriginal and non-Aboriginal children, and they were trying to find ways of trying to address this in terms of research. So just to expand on what SEARCH is a branch of the Sax Institute. It stands for the study of environment on Aboriginal resilience and child health. And this is, I think, the largest study that is going on in Australia involving Aboriginal children within an urban setting. And the reason why this is such an important study is approximately 57% of the Aboriginal population within Australia live in urban settings, but only 10% of that research is done with urban populations. So there's a huge disparity in the research that's being done, and this also is seen within a lot of the health disparity between Aboriginal and non-Aboriginal people is because of the urban populations, the urban Aboriginal populations living in Australia. So it's very important that we look into this. And one of the cool things that I found that SEARCH does pretty uniquely is that they have a very close collaboration with their participating Aboriginal Community Care Health Services, which is the ACCHS. So it's basically their collaborative partners that they're interacting with closely, and this is where they do a lot of their research at. So I think one of the cool things that I found about SEARCH was they weren't just doing research on some of the issues that Aboriginal communities are facing, but rather they were doing a lot of their projects were to ensure that the issues that they're facing, we can solve them as we go along with it. So for instance, let me just give you an example. Unfortunately, a lot of Aboriginal children, they face a lot of ear infections growing up, and because of this, it can result in deafness or hearing impairments. And to address this, while the SEARCH team was doing research to try and find out why more of this is happening, they were also providing health care to children so that we can ensure that proper preventative steps are being taken care of and that's being addressed. So just to talk more about the sites that were taking place, I don't know how clearly you can see this, but the SEARCH team worked with four Aboriginal ACCHS across New South Wales in Australia. So one of them was Wagga Wagga. It's the one on the bottom left. It's quite inland, and that has, I think, the second largest urban Aboriginal population within New South Wales. The two that were close to Sydney were one in Campbelltown. The Aboriginal Centre was called Tharwell, and in Western Sydney. So this is actually the largest population of This is the largest Aboriginal population of Aboriginal people within Australia itself. This is a very key site. And if you can look at the top, the most north is near Newcastle. So that I think that's called, forgive me if I mispronounce it, I think it's called Awakabo or Akawapo. I'm sorry if I mispronounce it, but it was in Newcastle, which is also a very important place because there's a lot of Aboriginal communities living in the urban setting. So in terms of what I did, I was looking at food security and obesity interventions. So the food security project was something that the search team was already working on when I got there. So I was part of that, but that wasn't something that I myself initiated. The thing that was mainly what I was doing was working on obesity interventions that are currently available for Aboriginal children within Australia, and that was more of a literature review. So for the first aspect, for the food security project, what we were doing was we were mainly trying to understand what are the specific factors contributing to food insecurity among Aboriginal children. And to do this, what they did was, it was a qualitative study in which the search team was going to the 4 different sites that I mentioned, and they were going to talk with community members, families, policymakers, like government officials, as well as people involved within the medical service, the Aboriginal medical services, to really try to understand what is happening. And through this, what I was doing was, when I got there, they had already collected the interviews. So they had a lot of very interesting information that I had to look through. And what my job was to really do a thematic analysis of the interviews and kind of analyze that in a more holistic way. So without going into all of the things, because this is something that's still being done and I don't want to reveal anything on behalf of the search team, if you guys are really interested, you can look into the study that will be published later on. But some of them key factors that were affecting Aboriginal populations, specifically family members, is the financial disadvantage that faces, that Aboriginal families face. This can be due to a lot of factors such as unemployment, such as mental health illnesses, which can contribute to an inability to provide for income. Another factor is, this is actually something that I personally saw, was the proximity barriers within their communities, and I'll expand more on this right now. So what I mean by that is, not only is it really, for instance, in a town like Wagga Wagga, which was a small town, it was really hard to get to the grocery stores. The Aboriginal communities, it was really hard for them to get to the grocery stores because they were just so far away, or there wasn't proper transportation. And even the grocery stores that were close by, where they didn't have proper food, it wasn't fresh, or it was relatively expensive. And because of that, it made it really hard for them to buy healthy, relatively inexpensive food. Another aspect that was actually increasing food insecurity in the way that it wasn't just their access to food, but access to healthy food, was even though they didn't have grocery stores, surprisingly, conveniently enough, they had a lot of fast food chains. Within Wagga Wagga, I think there was like 8 fast food chains, and Wagga Wagga is not that big of a city. So like the fact that, they had 8 McDonald's within Wagga Wagga. So like, I was quite surprised at the amount of McDonald's, and that just shows that because usually these fast food chains are relatively cheap, they're relatively easy to access, it just contributes to the further access to unhealthy foods, which is also detrimental. And one thing that I want to mention is the fact that a lot of Aboriginal families face stigma and a lot of unique cultural aspects. So just to give you more of some historical context, I think a couple of decades ago, there was an entire generation of Aboriginal children that were taken away from their parents because the government thought that they would do a better job of raising their children. So that had a lot of severe effects. It's like residential schools in Canada. So again, you can see the similarities. So because of that, what happens now is a lot of parents might feel a lot of stigma with trying to reach out for help because they might think that it shows that they're not doing a good job parenting their children, which I don't know if that's appropriate to say. But because of that, they have a kind of a reluctance to trying to reach out for support services that could help them throughout this, but also it could also result in an inability to kind of know what exactly is happening. And that really results in, again, the continuing problem of food insecurity. So once we figured all of this out, this was just trying to understand what's happening. So unfortunately, I actually didn't get to be a part of this, but what had happened was the search team had planned for a group motor building exercise to take place while I was there. And what that means is they would have a meeting with all the people that were involved in the initial interview stage. So the families, the community members, the government officials, and what we would have is we would have a facilitated discussion on what exactly is happening and how we can take what steps can we take to address the issues that we're facing. And I think they actually did this in February. So even though I wasn't able to be there, I very much would have liked to be there, and I like to believe that I was there in spirit. But again, that's something that they were hoping to come out of this. Is the next step was what can we do to address the issues that we have done, that we have discovered through this research project. So now this was the second stage of my time in Australia and with the Sax, was to really understand in terms of, so we already know that there's a food security problem. There's also an increased rates of obesity within the Aboriginal population. So much like Canada and other westernized developing countries, within developed countries, obesity is a huge problem. But the indigenous populations actually have far higher rates of obesity, and we wanted to understand, there's a lot of research being done on why that might be, but also what exactly are the strategies being employed by the current government to really address that. So we wanted to do a literature search to really look into the interventions that are already taking place and look into how exactly are they happening and what exactly are they doing to address some of the unique factors that are affecting the Aboriginal young population. So so let me just talk about some of the search. So we actually did a very extensive search. We wanted to try to find anything that we could find in terms of anything that would involve an obesity intervention or a treatment program, as well as have some information on Aboriginal youth. So I'm sure you guys might know the first four, but the last one is actually a Indigenous specific database. It's called Health InfoNet. And we use this because it basically is a gold mine. It has a lot of Aboriginal relevant information, a lot of Aboriginal relevant research. And we use this to kind of supplement our search. But despite this, we were only able to find 9 interventions. And I know that you might think, oh, 9 interventions. But the thing is, these 9 interventions were the only interventions that talked about an Aboriginal population or Aboriginal subsection of the children that were already taking place within this obesity treatment program. And throughout this, throughout these studies, only 1 or 2 of them actually talked about specifically Aboriginal children. Because the thing was, for instance, the problem was some of them were small-scale studies, but the ones that were upscaled treated Aboriginal children like the rest of the entire population. So the studies that actually did look into how effective it is for Aboriginal populations, they found that Aboriginal children were statistically less likely to finish the program itself, which meant that these programs are not as effective for these children, which kind of leads to the problem of, okay, we are putting resources and money into the development of these programs, but looks like a lot of the effect that we want to have is actually not happening. So in terms of that, that was a really unfortunate discovery that we made, but it was kind of to be expected from what my colleagues said. So some of the recommendations that we found, or some of the things that we thought that could happen to increase the effectivity of these programs, was make more culturally appropriate programs. So kind of understand the unique factors that are happening within Aboriginal communities and try to address that. So try to involve more of the community members, try to involve more of the community leaders to try to develop these programs alongside the researchers. And in that way, we could have a program that's more effective and it's more flexible, so it allows for community adaptations to really adjust to some of the problems that they see that are going in terms of the program development. And one of the additional things that we found was, when I was actually initially doing the search, what I struggled with was there were some interventions that were taking place, but they had no data that I could actually look into. So even though I knew there was studies being done, there was interventions taking place, I couldn't really do anything with that because I couldn't analyze that and I couldn't understand what part of it makes effective or what part of it doesn't make it effective. And one aspect of that was because a lot of Aboriginal communities that are doing a lot of these interventions, they don't have the capacity to do research. So one recommendation that we think is necessary is we need to have greater collaboration with researchers, but also with the Aboriginal community to allow them to do more research on their own, so that even if interventions are taking place, they can be properly studied and documented so that we can understand what's working and what's not working, so we can replicate it in other places. And that's one avenue of the search team that I thought was very well done, because as I mentioned before, the search team was, the Sax is in Sydney, but their 4 sites are mainly Aboriginal run. A lot of the Aboriginal community members are working within these sites, and these Aboriginal staff are usually the ones that are doing the research. So in that way, I think it's very important if this type of model is adapted, and it's kind of used to increase the capacity within Aboriginal communities to do the research that is required and to really have a greater analysis on what makes these programs effective. So just to kind of summarize some of the things that I did for my QES, just to give you a brief timeline of what happened. So when I arrived in September, it was a bit of a chaotic time. I was trying to adjust what was happening. I was trying to understand what exactly the Sax is doing and how what my role would be. And in October, what we started doing was my supervisor, Sumitra, I call her Sumi, she started introducing me to the food security and all the interviews. So I started using the interviews to do a thematic analysis. In November, again, Sumi kindly arranged for a trip to Wagga Wagga. She thought it would be very interesting for me to go and see the AMS, the Aboriginal Medical Service at Wagga Wagga, as well as see Aboriginal community members and see some of the type of things that the search team does with the Aboriginal community, which I absolutely loved. It was a 4-hour drive from Sydney to Wagga Wagga, and one of my coworkers, she brought her kid with her, and it was just like, he's hilarious. It was a wonderful time. It was a really good trip. And we saw a lot of kangaroos. Unfortunately, they were all dead because they were all roadkill. Yeah, they're the equivalent of deers to Canada because, and I'm going a bit off tangent, but when they see like headlights, they actually jump in front of the cars. So yeah, it's really unfortunate. And on that note, continuing on, in November, I started working more on the literature review, trying to really get that going. And I continued doing that up till December. Even now, we're on the finishing stages of that, so I'm still working on that as I go along. But in December, one other thing that was very interesting that we had at the Sax, what they have is, I don't know if it's a yearly meeting or if it's a quarterly meeting, but what they did was they had a stakeholders meeting in which what it was a dialogue between the researchers at Sax and the community leaders at the Aboriginal Medical Services. So what they did was, this was a meeting for them to really come together to talk about some of the research that's being done, some of the programs that are being developed, some of the grants and the proposals that are being proposed within NSW. And I think it was a very good opportunity for me to see from a very broad perspective on how exactly research has a role in policy development, and how on a very ground level that affects the communities that this research is really geared towards. So for me, I was very, very happy to be a part of that before I left, and that was, in a brief way, what I did at the Sax. So now to talk about some of the fun times that I had in Sydney. So as I mentioned before, I absolutely loved my time in Australia. Sydney is one of the most beautiful cities that I've seen. The beaches, the coastline, it's absolutely wonderful. So the points that I marked was all the places that I went. I'm sorry that it's not zoomed in, but if you see the cluster of dots, that's where Sydney is. So most of that was either with my colleagues. As I told you before, Sumi was very, very nice. She took me a lot of places. She took me to the west, she took me to the east, we went to the beaches. And then alongside that, we also had a trip to Wagga Wagga, which is where I went. It's like the only inland place that I went. But then I took a trip with my family down to the south, to near Melbourne, and it was wonderful. And so, as I said before, I didn't really have a kangaroo pic, so I decided to Photoshop it in. But yeah, so On the left is actually a bit halfway between Melbourne and Sydney. That was on one of the places that we stopped. One of my family members took me. If you can see it, they're in the background. They're taking pictures of themselves. So yeah, we all had a wonderful time. We went surfing as well. So by we, I mean Yina and I, who was the other QES scholar that went to Sydney that time. And I like to say that I was better than her. But to be quite frank, I don't know what exactly that means because like I never actually stood up on the surfboard even once. Like I was just flopping on the waves. So I don't know if that's anything to be proud of. On the left is there's a mountainy range called the Blue Mountains on I think an hour or two of west of Sydney. So the reason it's called Blue Mountains is because there's a lot of eucalyptus trees within that range. So when the sun shines upon those trees, it gives up like a blue aura. And the three rocks that I'm posing near, they have names. I'm sorry, I don't remember the names, but they're Aboriginal names. And I think they're 250 million years old. So it's one of the landmarks near Sydney. Another landmark of Sydney is the Opera House and the Sydney Harbour Bridge. So my house was about 10 minutes away from the Opera House and the Harbour Bridge. I used to go there almost every weekend. So it was like a wonderful time. It was a nice place to walk around, and usually it was quite sunny and nice. So it was a nice time. Ina and I actually met up there, coincidentally, not planned at all, like a couple of times. So it tells you how many times we were there. So it was wonderful. We actually had a event. It was I think it was the 50th anniversary of Tharwal, which was one of the Aboriginal medical services west of Sydney. So this was their anniversary dinner, and I got to go there. I actually did not take a suit, so Sumi was the one that lent me a suit of her neck. So I was like I keep saying like how wonderful my team was. So starting from the left to the right, on the left was one of the ladies that works in the Aboriginal Medical Services. Right to her is Hillary. She was no longer working with the team, but she was previously working with the search team. Right beside me is Simone. Simone was one of the PhD students I was very closely working with. She's wonderful. She's the mother of the child that I said was absolutely hilarious on the way to Waka Waka. Myself, Christian, who is another PhD student in the search team, and Nicole, who is she was an audiologist, and she works as part of the hearing health study that the search was doing. So just to briefly talk about New Zealand, I also went to New Zealand after Australia. I don't want to take too much time, but I went to the North Island. I landed in Auckland, and then I went to the South. New Zealand is by far one of the most beautiful places I've ever seen. There's just some beautiful landscapes, and yeah. So I don't want to take too much time, but it was an absolutely wonderful trip, and I'm really glad I got to go. I found that Australia was very similar to Canada in cultural wise, especially with the things that I found in terms of how they kind of work alongside their Aboriginal community. New Zealand was a bit different, I think, culturally, because they've actually they very much tried to adopt their indigenous heritage. They have the Maori, and what I found absolutely amazing was their second official language is actually the Maori language. So I was actually pretty amazed by the fact that this was a very integral and proud aspect of their history. So for me, I think going to Australia and New Zealand, it was a very good trip, not only because I got to sightsee, but I also got to see some of the differences that might be present culturally, even though they're very close together. So thank you for giving me this time to present what I did, and I think Gareth is going next, so thank you.
So thank you all for joining us today for our Queen Elizabeth Scholarship webinar. We have lots more webinars coming up in the future. If you're interested in our Queen Elizabeth Scholarship program, the first link that's on the screen there takes you to the information page where you can learn about the scholarship and how you can apply. The second link is a link to all of our presentations and webinars that are upcoming, so please join us again. And the third link is to our blog page that our scholars write blogs regarding their trips. So feel free to read a little bit more detail about some people's trips, more personal insights. That's all available there. So thank you again for joining us. Thank you to our Queen Elizabeth Scholar presenter, and we'll see you again soon.